Hello, my dear colleagues. Today we will discuss the next topic, epidemiological characteristics and fundamentals of the prevention of herpes virus infections. My name is Olga Alexandrovna Gorbich. I am Associate Professor, Epidemiology Department. You see outline today lecture, which includes 7 points. The first point, background of herpes virus infections. The next point associated with the definition, these in nosological form. Then we will discuss structure of herpes virus infections. Then multiplication, herpes viruses, then classification, different approaches. And the next point, epidemic process of herpes virus infections, and the final point, preventive vaccinations. I start with the background of the problem, herpes virus infection, and you see that this infection associated with high incidence rates in the population. You see experts' opinion from World Health Organization, an estimated 4 billion people under age 50 have herpes virus 1 infection globally, and you see that 491 million people infected herpes virus 2 infection. If we discuss point associated with the background of this problem, I want to say about relapse of these diseases, severe clinical presentation, oncogeneity, human immunodeficiency, virus indicated disease, and you see that infection with herpes simple virus 2 increased the risk of occurring and transmission HIV infection more than 3 times. Then can cause illness in newborn baby, like neonatal herpes, and lead to abnormal pregnancy. If we describe situation with preventive measures, I want to say that not all herpes have vaccines, and some experts say that this virus play important role like a trigger in Alzheimer's disease. At first, I want to start with from the definition herpes virus infections, and you see that herpes virus infections are a group of clinically diverse human diseases caused by viruses of the herpes virus family. It proceeds in the form in apparent, subclinical, manifestal forms, which are possible in conditions of primary or secondary immunodeficiency persons. This herpes family differs in polymorphism of clinical manifestations, predominant damage, and the skin and the mucous membranes. With the generalization of the process, any internal organs or a person can also be affected. On this slide, you see structure of herpes viruses, and you see that the structure includes folloid structure, and the first component of the structure core, it's a double-stranded DNA genome. that this virus characterizes pentahedral capsid, which are composed of capsomeres. You see that the capsid is surrounded by a protein coat called tegument, and you see that this virus associated with a glycoprotein bearing lipid below enveloped. If we characterize, or if we try to characterize multiplication of herpes viruses, I want to highlight this transcription, genome replication, capsid assembly occur in the host cell nucleus. Genes are replicated in a specific order, and you see on my slide 3 steps. The first step associated with the immediate early genes, which encode regular proteins. Then you see the stage number 2, early genes, which encode enzymes for replication of viral DNA. And the final stage is associated with late genes, which encode structural proteins. I want to highlight that the latest viral genome may reactivate in any time. The mechanism of reactivation is not known, but in some publication you may see different triggers, different factors which are associated with this process. You see in details 2 points associated with the replication part of these viruses, his life cycle. The next position which we should know associated with herpes classification, and you see that more than 2 known herpes viruses are opened in our days, and 8 of them routinely infect humans. All herpes viruses can establish a latent infection within specific tissues, which are characteristic for each virus. You see 8 viruses which are associated with the human population, and you see that these viruses includes in 3 subfamily, like alpha herpes viruses, beta herpes viruses, and gamma herpes viruses. And you see that these viruses are characterized different points associated diseases. For example, if you see herpes simplex virus 1, it is associated with oral or genital herpes, conjunctives, or encephalitis. If we characterize the virus herpes simplex virus number 2, you see that the same part, it is associated with genital herpes, in some situation maybe oral herpes. And if we characterize varicella zoster virus, virus type number 3, you see that it characterizes high level seroprevalence in population, and you see that this virus is associated with varicella or chicken pox or herpes zoster, like shingles in people with human immunodeficiency or elderly people. And in some situation you see that these viruses associated with the post-transplant herpes zoster, congenital varicella syndrome, and so on. If we characterize the subfamily beta herpes viruses, you see that it includes three components, three viruses, viruses number 5, 6, A and B, and virus number 7. And you see that the main part, the main role plays cytomegalovirus, and you see that it's associated with severe congenital infection leading to neurological impairment, associated with the immunocompromised people, and associated with liver failure, rhinitis, and esophagitis. Viruses like 6, A, B, and viruses 7, these viruses live in immunocompromised people and cause chronic tiredness, depression, and other non-specific symptoms associated with human walking, human activity, human mood, and so on. And the last subfamily, common herpes viruses, like viruses number 4 and 8. These viruses associated with deeper immunosuppressed condition, different patients, and these viruses associated with two diseases like cancer disease or human immunodeficiency disease. So you see that herpes classification includes three subfamilies: alpha, beta, and gamma herpes viruses, and you see that the grouping of herpes viruses into subfamilies serves the purpose of identify evolutionary relatedness as well as summarizing unique properties of each member. So we start from alpha herpes viruses, and you see main points or key points which characterize alpha herpes viruses. So you see that the members of alpha herpes viruses includes three components or three groups of herpes viruses, like viruses herpes simplex virus 1 and 2 and varicella zoster virus. These family characteristically established latent infection and in sensory nerve ganglia, and you see that the members of the alpha herpes virus family are characterized by an extremely short reproductive cycle. I mean hours needs for this virus, prompt description of the host cell, and the ability to replicate in a wide variety of host tissues. These family or subfamily are characterized more easy diseases if we characterize people without immune suppressed condition, but in some situation it may associated with severe clinical features. The next subfamily beta herpes viruses, and you see that in contrast to the alpha herpes viruses, beta viruses have a restrict host range. Their reproductive life cycle is long, and in days, some days, with infected progressive slowly in cell culture systems. And you see that the characteristic of the viruses is their ability to form in enlarged cells, and you see such nosological form like human cytomegalovirus infection, cytomegalovirus infection. These viruses can establish latent infection in secretory glands, cells, or the reticular endothelial system and the kidneys. And the last subfamily, the gamma herpes viruses, have the most limited host range. They replicate in lymphoblastoid cells in vitro, and they can cause lytic infection in central digested cells, and if we characterize clinical feature or prognosis, I want to highlight that these very terrible and severe clinical features with deep immune suppressed, and you see that latest virus has been demonstrated in lymphoid tissue. Epstein-Barr virus is a member of this family, and you see the viruses number 4 and 5. In some publication you may see that viruses number 6 and 7 are probably best classified as a gamma herpes viruses, but it's a discussable question today. So maybe in future studies we need to clarify the most appropriate classification of these viruses. If we characterize epidemic process of herpes virus infections, you see 3 components, necessary components for realization epidemic process in human population. You see that the first component is the sources of infection, then the component number 2, transmission mechanism, or mechanism if we describe different position in this point, and the final point, an organism susceptible to the pathogen. This slide describes different sources of infection, herpes virus infection I mean, and you see that in your clinical practice you may see a patient with rash symptoms, herpes labialis, maybe different elements on their face, in their oral cavity, like Epstein-Barr virus dissemination, and you see that different stages herpes labialis on my slide, and you understand that such patient are the sources of infection, herpes viruses, for you and for another persons. If we describe sources of infection diseases, I want to highlight that body fluids on my slides contain herpes viruses, and you see a lot of different fluids like saliva, blood, sperm, vaginal discharge, urine, organs and tissues, and so on and so on. The component number 2, which we include to epidemic process of herpes virus infection, is transmission mechanism, and I want to describe different mechanism which necessary for herpes viruses. So you see that this virus prefers 3 mechanisms like contact, aerosol, and vertical. The first mechanism, contact, and you see it plays important role for susceptible people with different situation when they kissing during sexual contact with contact hold host transmission, for example, and this very popular mechanism for realization herpes viruses infection among human population. The next mechanism, aerosol, and you see that this mechanism play important role during a bone droplet, dust, a path with contact household transmission if they have such actions like on my slide, like apshi, or maybe they don't use different components like masks or handkerchief for their fluids, and these viruses contaminate different elements, environmental elements, and may fly in air. And the final mechanism, vertical, you see that I describe on my slide 4 stages, like ruminative stages, homogeneous, transplantation, stages, ascending route of infection transmission, and intranatal child birth. If we characterize a different parental intervention associated with invasive therapeutic and diagnostic procedures, we may meet with the artificial mechanism of transmission, and you see that this mechanism play important role in such situation like transplantation or post-transfusion infection associated with the herpes virus family. And the last point, epidemic process include an organism susceptible to the pathogen. On this map you see regional estimates of the number and prevalence of herpes simplex virus type 1 and 2 infections in human population, different different cohorts like females and males, and you see that some countries characterize more higher level prevalence of these diseases. In some countries we haven't enough information about this disease, and you see that when we characterize regions, you see that people with the oral herpes simplex virus type 1 was largely in the Southeast Asia region, follow the Western Pacific region. When we characterize a situation with the number of people who infected these viruses, you see number 192 million people from age 15 till 49 years old worldwide. And you see that when we characterize genital herpes virus number 1, the highest level of this prevalence in the region like Americas, and then follow European region. And the main points why different people have differences to susceptibility to herpes virus. You see that it is associated with age, nutrition status, environmental condition, different immune status, comorbid conditions, different therapeutical or diagnostical procedures, and of course change normal intestinal microbiota, which plays important role for our immunity. And the final part of my lecture is the prevention vaccination, and I want to say that of course we know and hear a lot of about varicella zoster vaccination, about chickenpox vaccination, but I want to show you prophylactic or preventive and therapeutic vaccination against herpes simplex virus number 2. And you see experts, World Health Organization's opinion. The first point associated with the prophylactic or preventive vaccines, you see two parts, advantages and disadvantages, and you see 3 points when we characterize advantages, because the herpes virus vaccines against herpes simplex virus number 2 is strategic priority for experts, World Health Organization. And you see that especially for sub-Saharan Africa, and you see that World Health Organization tries to use some different programs of immunization for delivering vaccines to infants, because its situation associated with a high level of prevalence of these diseases. But you see some disadvantages. The first position associated with early dosing with need to effective in people who are human herpes simplex virus 1 seropositive. Then you see that in some situation the vaccine would need to be administered very early in life, and the last position is likely to require larger clinical trials than for therapeutic vaccines. And you see therapeutic vaccines, and you see advantages and disadvantages, 2 points, which includes some position. For example, if you characterize advantages, you see that this vaccine may be available for implementation sooner than prophylactic vaccines. You see that we describe a situation with risk factors, infected human who have herpes virus infection in their organism, more high level risk for infected human immune deficit viruses, and try to solve this situation. And the last position associated with good alternative antiviral therapy for symptomatic human herpes simplex virus infection, especially for such points like cost, dosage, and delivery options. And you see 5 disadvantages for this approach. You see that people who have herpes simplex virus 2 infection at an increased risk for human immunodeficit situation. And you see that without reduction in herpes simplex virus to transmission or the risk of HIV cohesion along with reduction on different symptoms. Therapeutic vaccines may not have broad population level impact in MIC, and you see that in some situations therapeutic vaccines may affect the concentration of cell-expressed receptors for HIV in the genital tract is unknown. So you see that when we use vaccine, we try to protect two or three herpes viruses, like herpes virus, simple herpes simplex virus number 1, 2, and 3. But we should remember about 8 viruses associated with the human population and causing different serious disease. Thank you for your attention. Be happy always.